Okay, so this is a video going over the different types of edema related to the eye. And so one that we'll encounter a lot here is that known as papilledema. Okay, and so papilledema is also known as optic disc edema. And that optic disc is the head of the optic nerve or cranial nerve 2. And so you'll see that it is, when you look at it with a fundoscope, it looks pretty swollen. And papilledema, when you hear papilledema, I want you to think of increased intracranial pressure. Okay, so that means that the problem isn't within the orbit of the eye itself, but actually behind that orbit. And since the optic nerve is, the connection between one of the main connections between the eye and the rest of the brain, that's where you see it. So it's increased intracranial pressure, behind the eye essentially. And so some common etiologies of papilledema are, you'll see a major one that you'll see is any sort of cerebral venous sinus thrombosis. Venous sinus thrombosis. And this makes sense. The venous sinuses of your brain are going to drain blood and CSF. And so if any of these are obstructed, you'll have that backpropagation of pressure, and that can cause the intracranial pressure to rise. And you'll see it manifested as papilledema. But you can also see it with hydrocephalus. And you can also see some infectious causes. So meningitis will raise the intracranial pressure. And then you'll also see, you have to consider brain tumors. So a space-occupying lesion, whether it be solid as a brain tumor, or a liquid space-occupying lesion, such as, or fluid space-occupying lesion, such as an intracranial hemorrhage. So think subarachnoid hemorrhage, hemorrhagic stroke, intracranial hemorrhage. So as you can see, papilledema has some pretty serious causes, right? It can be anywhere from a thrombus obstructing the venous sinuses. It could be related to that hydrocephalus, either communicating or non-communicating. There could be an infectious agent, such as Neisseria meningitis, and then you can even have a brain tumor or a brain bleed, intracranial hemorrhage. So these are all pretty darn serious for papilledema. The most important thing to remember is increased intracranial pressure. Now let's compare it to conjunctival edema. Conjunctival edema. And so conjunctival edema is also known as chemosis or orbital chemosis. And it's characterized by swelling of the conjunctiva of the eye. Remember, the conjunctiva is this thin membrane, translucent membrane that is draped over, that lines the eyelids and also the exposed anterior part of the sclera. Okay? Also is highly vascularized. It carries a lot of the blood vessels in the eye. And so if you have swelling of the conjunctiva, that's known as chemosis or conjunctival edema. And this is, as most edemas, it's characterized by just increased vascular permeability and subsequent fluid accumulation in the conjunctiva. So why might this happen? So some common etiologies that we associate with conjunctival edema are a viral or bacterial conjunctivitis, right? Which means simply that there's an infection of the conjunctiva. So think pink eye for viral, or if it's bacterial, think maybe like a staph infection of the eye with pus around the eyes. A purulent discharge is what you're looking for in bacterial conjunctivitis. Then a much more serious cause for conjunctival edema would be orbital cellulitis. So that means that you have a infection of the soft tissues within the orbit, or it could be posterior to the orbital septum. And this is pretty severe, orbital cellulitis, requiring immediate hospitalization for the damage it can do to those structures. So if you do see conjunctival edema, that is something that you should have on your differential, orbital cellulitis. And then we also see conjunctival edema with cavernous sinus thrombosis. So this is a specific type of cerebral venous sinus thrombosis, but it kind of stands apart. So cavernous sinus thrombosis. And if we remember, the cavernous sinus receives blood from the superior and inferior ophthalmic veins, and these veins drain the orbit, the eyelids, and the conjunctiva. So it makes sense that when there is some sort of obstruction of the cavernous sinus, this will impede outflow through the ophthalmic veins, and that will result in increased venous pressure, congestion, and it can manifest as conjunctival edema. Okay, so have those things, in mind when you see swelling of the conjunctiva or conjunctival edema. And so then the last one that we want to consider and really distinguish from the previous ones is periorbital edema. Now here, let's talk about periorbital edema. So one of the first things that I like to point out about periorbital edema that sets it apart from papilledema and conjunctival edema is that this is what we call an extraocular finding. So unlike the previous two that were ocular findings, this one is extraocular, which means that it doesn't directly involve the eye. But we put it in this video so that you can distinguish it from the other two types of eye-related edemas. And periorbital edema is swelling of the soft tissues around the orbit. So examples of this are, it could be swelling of the soft tissues of the eyelids, or even of the periorbital skin. Okay, and it manifests as, or it presents with visible puffiness around the eyes. And so some etiologies that we can consider here are, first and foremost, you see it with allergic conjunctivitis. So remember that a conjunctival edema, we saw it manifest with viral and bacterial conjunctivitis. Conjunctival edema can also manifest as part of allergic conjunctivitis, but when you have an allergic inflammation of the conjunctiva, you really will see that visible puffiness around the eyes, right? That's kind of a classic association there. And then you can also consider, similar to how conjunctival edema, you should consider orbital cellulitis. With periorbital edema, you can consider periorbital cellulitis. So that's just, with periorbital cellulitis, kind of analogously, it is it's infection of the eyelid and the soft tissues in front of the orbital septum, but it's pretty confined to the eyelid and its surrounding skin. So it's less serious than and severe than orbital cellulitis. You should also consider some other etiologies like sinusitis, because those nasal sinuses and sinuses around the eye and nose are really close to this periorbital area and associated with the periorbital area. And then here's a unique one, which is nephrotic syndrome. So if we remember that when you have nephrotic syndrome, you have a lot of loss of blood, of protein in the urine. So you have no blood in the urine, but you do have this, what is characterized as this massive proteinuria, where you're urinating out your proteins. And when you do that, you are decreasing the oncotic pressure within your vasculature, and so that's going to allow the outward-facing hydrostatic pressure within your vasculature to dominate and push fluid out of your capillary beds. One of the first places that we see that is this puffiness around the eyes. So if you see puffiness around the eyes, you really do want to consider if it could be a nephrotic syndrome, and run further investigate the health of that patient's kidneys. And then, of course, also similar to conjunctival edema, we see periorbital edema as a sign of cavernous sinus thrombosis. So again, we explained the mechanism of cavernous sinus thrombosis and how it would result in edema of the conjunctiva. Similarly, it would result in edema of the periorbital area as well. So you have to also consider that for when you see periorbital edema. So we kind of covered them in degree of I would say roughly in degree of severity, right? So if you see papilledema, you think increased intracranial pressure, and some pretty serious stuff can cause papilledema. You really want to make sure that you're looking at meningitis, any sort of tumor or intracranial hemorrhage. And then when you're looking at conjunctival edema, you really want to make sure that you are looking at, it could be a viral or bacterial conjunctivitis, which is not as serious, right, as the previous etiologies, and it could also be something much more serious, which is orbital cellulitis. And then with periorbital edema, remember, first and foremost, it's an extraocular finding, and it's that characteristic puffiness around the eyes, and its etiologies are, a lot of times, it's just allergies, right? Could be an allergic reaction, but it could be nephrotic syndrome. And remember that cavernous sinus thrombosis will present with, a lot of times, periorbital edema and conjunctival edema. And that's all for this video.